Welcome back, guys. If you are just joining us, this is INX Prime Live. Remember, we are on your screens every single Monday to Friday between the hours of 6 p.m. and 8 p.m. Now, it's important for us to start up the week with a lot of motivation and inspiration. And sometimes we need those moments that take us to the next level, be it in terms of self-improvement or self-development. Now, we are going to be listening to the incredible award-winning motivational speaker, Jabu Zwane. Let's take a look.
Well, good evening. Welcome to Monday Motivation. Yes, my name is Jabu Zwane. Thank you so much, Zarif, for that warm introduction. Well, you may or may not know that tomorrow is International Men's Day. Well, we all know about Women's Day, and it is well advertised. Normally, there's a lot of media coverage around the actual day. But unfortunately, when it comes to Men's International Day, that is not necessarily the case. So in case you don't know, tomorrow is International Men's Day. And there are very important pressing issues that we have to discuss regarding men. I'm also very excited to let you know that tomorrow, actually, on my platform, on TikTok, my team and I are going to be running from 9:30 up until 10 o'clock in the evening. Yes, we're going to have about 14 different speakers on live, some locally, some international, where we're going to be talking everything related to men's well-being. So feel free to join in on my handle, Jabu Zwane, at Jabu Zwane Talks, at Jabu Zwane Talks on TikTok, and then we can talk about all things relating to men. And tonight I want to really talk about that. Like, what can we do with the current status of men's mental health globally? Because the stats are out, right? We know about suicide, that men are 4 times more likely to commit suicide, or rather the suicide rate of men is 4 times that of women. And what is quite interesting is the fact that actually Southern African countries are actually very high up on that list. As a matter of fact, Lesotho is number 1, which has a whopping 84 suicides per every 100,000. So the way that the global rate of suicide is measured is per 100,000, as is the case, of course, with crime. Lesotho is 84 people that are taking their own lives per every 100,000. Second is Eswatini, which is about half of that rate. And then about the 5th and the 6th, you're looking at South Africa, which is about 23, 40, also about 40 people that are taking their own life per every 100,000. And out of that 40, you're looking at about 28 that are actually men. And then after that, you have Zimbabwe. But globally, the Southern African regions are not doing well when it comes to mental well-being and when it comes to mental stress. On the mental state, the global mental state, South Africa, when it was ranked among 64 countries, we ranked at the second bottom. We had the second lowest mental health well-being or mental well-being in the world. And we rated as the most distressed country in the world. Second to us was the United Kingdom. So all those stats tell us that there are some serious issues that we need to talk about. And tonight I want to dedicate the next few moments just talking about that. What are the 5 main issues when it comes to mental well-being? First one, as I already mentioned, is high suicide rates. The second one is undiagnosed depression. That so many men, because they do not go to the doctors, most of their conditions don't actually get diagnosed. Now, I'm not talking as an expert or as a doctor or anything like that. I'm just simply talking about this as a mindset development specialist. And based on some of the documents I've read from the World Health Organization and from other online platforms as well. And then the third issue is the substance abuse, that men are more likely to abuse alcohol, to abuse drugs, to get into gambling, and many other types of addictions that we cannot even mention here online. The third thing is workplace burnout. And then the last one is the issue of stigma and shame, that most men are not going to talk about how they're feeling, because unfortunately, most times, men do view talking about their issues as a reflection of some kind of weakness. And unfortunately, also, they do view it as a reflection of not being masculine enough. And as a result, a lot of men are suffering internally and are not attending to the issues that are relating to their mental well-being. And so what we need to think about as well is that what are some of the five main causes, and I'll then go into the actual actions that we can do to help out the men in our lives. The first one, of course, are the societal expectations around masculinity. The fact that there still is that very strong belief that men are providers, men are protectors, men are supposed to be leaders, men are supposed to have it all together and not fall apart in any way. And unfortunately, in an environment, especially in Southern Africa, let's think about the socioeconomic conditions where we have the highest unemployment rate, Lesotho being number one again. In South Africa, we know that recorded was up to 62% of our young people are unemployed, the majority, of course, of whom are young men. And we also have very high unemployment. We've got high crime issues. And so those psychosocial conditions, unfortunately, oftentimes also they affect men disproportionately, having the highest levels of homelessness. And as somebody that at one point around the age of 19, who as himself was homeless, I was homeless myself for 4 months, living in an abandoned building just outside of Alexandra, between Marlborough and Alexandra, while I was still looking for work. Understanding that these are some of the issues that actually cause the problem. And of course, we've got issues of health, of relationship problems. And then lastly, what we've got is that exposure to violence, as I've already mentioned. Now, these are some of the factors that are currently, men are currently experiencing. Not that women are not, but as I've said, there are quite a lot of campaigns that are specifically dedicated towards helping out women, but not so much that is happening towards helping out men. And I want to then talk about what are the 5 practical ways that we can really intervene in this situation. The first thing I want to say to you is that if you have a young boy that you're raising, if you have a son that you're raising, there are certain crucial lessons, I think, or skills that we need to then pass on to our young boys, because another stats that are coming out is the fact that young boys are struggling academically far worse than girls. They're not doing very well academically. They're not doing very well in terms of cognitive development. They're also falling behind when they get to the university level. And unfortunately, with a lower education, then that also presents lower prospects of success. And then with the lower prospects of success, it also presents then the failure, in a way, failure to meet the societal standard to provide and to protect, as society normally does. Unfortunately, then put those expectations. And the end result is that under pressure, a lot of mental strain. I was even informed the other day by a friend of mine telling me about 2 of our friends that we went to high school with that took their own lives 2 weeks in a row. Again, I don't want to make this very dark, but I want to talk about what are some of the practical situations that we're going to be doing. The first thing is that we need to understand that this is a global problem. So there's got to be a global attempt. There must be a macro vision to address issues and causes that put a lot of men under strain, especially those at disadvantaged communities. Because unfortunately, even in South Africa, one of the challenges is that there are, for every 100,000 people, there are only 3.2 psychiatrists. And as a matter of fact, for every 100,000 people, there are probably, I think the last time that I checked was about 1.7 psychologists. What that basically means is that people that are in the rural areas, people that are in the townships and in the areas that are away from the city and from the commercial areas, it's even worse than that, because that number's averaged out. And unfortunately, they're the ones also that are suffering quite a lot when it comes to the factors I've already mentioned. And so at policy level, there has to be some of those attempts. But at a personal level, for you and I, it is important to be aware that this is the reality so that we can be able to check in with the people who are close to us. When you start to see some kind of a change in behavior, where you can see that this man that I know, whether it's a brother, whether it's a son, whether it's your husband, or whether it's a cousin or a colleague, that you can see there's a change in behavior. They seem a little bit down. They seem a little bit depressed. They're not as enthusiastic anymore. They seem a bit irritable, and they seem maybe even showing some kind of spouts of potential violence, it's important to check in and find out, hey, what's going on? And the second thing that is important for us to do is that, especially for us as men, is that to realize that this cannot change unless we actively are involved with campaigns, with projects, with intentional plans and strategies to ensure that we create safe spaces for us, psychologically safe spaces where we can talk about some of our struggles without judgment, without fear of shame, where it is okay for us even to be vulnerable. Although I can understand how that word can be such a turn-off for many men, but maybe the word that is more appropriate would be to be transparent about some of the challenges that we're currently facing and to talk about them so that we can then seek out help. And the thing is this, when someone is talking about some of the challenges that they're going through, it's important to give them an ear and not to be judgmental or not to laugh at them or even to play light of whatever it is that they're telling you, but to really be sincere and ask questions and listen. The second thing that we're going to talk about is that we need to make it easy, especially if for those who are corporates, to make it easy to access healthcare. I know, thankfully, that many companies in South Africa do have employee wellness programs or employee assistance programs where there's an offering for free counseling. So maybe you happen to be a man out there and you don't even know that this is what is available to you at your workplace. It is important to find out from your HR if such a service exists, because oftentimes you can get up to 4, maybe up to 6 times free different counseling sessions where you can be able to process and have somebody that is an expert talk to you about how you can practically regulate your emotions, manage your mental stresses, and manage your emotions in a difficult time that you may be going through, whatever that is. And I think for even myself at our institution and for other institutions similar to mine, or maybe even bigger than mine, is that it's important for us to collect data, to have credible data that tell us exactly what is the pulse of men's mental well-being. And to be able to make that distinction between, again, mental health, which are those officially diagnosed conditions by psychiatrists and psychologists and people who are accredited, even sometimes GPs, and to make a distinction between those types of conditions, such as your bipolar and all of that, and also mental well-being situations, which is about how are you managing with your stresses? How are you coping with your stresses? So it's important for us to develop community workshops, to create supporting networks, to create affordable counseling services, even for some of us who are professionals, to make those easily accessible and affordable, and to create those awareness days. And as I've said, tomorrow we're going to be running all day talking about all things related to men. And it is important for us as a society to be encouraging, to be open, to be inquiring, and to be caring, compassionate towards men, as opposed to just always thinking that they're strong enough that they can handle on their own. Because unless we all collectively put together our love, our efforts, our resources, our intellectual capital, our spirituality, and everything else that we can put into this pandemic, nothing is going to change. And unfortunately, things are going to get worse. And I'm afraid that we might actually end up losing more and more men to struggles. My name is Jabu Zwane. Thank you so much for tuning in. I hope that you got some information tonight that can encourage you to do a bit more to attend to men's mental well-being. Thank you so much for tuning in. Enjoy the rest of the programming. Good evening.